Okay, so we've got a painful lesion in the middle of the foot here, which is not the most common spot, but we do see quite a few of these come through the clinic. And so basically what it is, we're debriding this overlying callus just to see what's in there. Now we're suspicious that it might be a thorn or a corn, but usually these ones end up being corns in this part of the foot, unless they've got a history of working outdoors or being a hairdresser and getting a hair splinter or something like that might tip us off to it's not a corn. But usually these ones are a corn or a wart. So we go in there, you can see we've cut away all the overlying callus and it's not bleeding, so it kind of rules out a wart. So then we go ahead and dig it out, and you can tell just by the appearance that it's a corn because it's got that more translucent, uniform consistency. So we go ahead and cut out here around the border of the living and dead tissue, trying not to hurt the patient. It can be a little bit painful as we get towards the end. We're using a number 15 blade here because it's a nicer size to get this corn out. You can use a bigger blade. It doesn't really matter what size you use, just as whatever you're most efficient with and cause the least amount of pain. So we go ahead and clean out all of the hardened skin. So being really careful not to just pull on it too much, but actually be cutting it rather than pulling it. And then you can see I'll try and get this all out all in one go if we can to show you to the camera. And it just makes for a really nice removal if we can get it all out in one go, and we don't have to go digging back in there because it's a little bit more unstable once we remove the big part of the corn. So that's the corn. You can see there. You can see it's all really, really hard. If we give that a squeeze, it's very, very hard and very painful to walk on. And so we'll go back in there and clean that up and tidy it up, and that's where the corns come out of, and that's how we remove a corn in the podiatry clinic.